This is Optimal Relationships Daily, episode 1251, What You Need to Know About Postpartum Anxiety, by Jessica Jondle with Healthline.com. Hello, everybody, and happy Friday. I am your host and narrator, Greg Audino, here with you every day to read some of the best relationship blogs around. And if you've been listening a while, you know that Thursdays and Fridays are saved for parenting content specifically. So with that, let's hear this post from Healthline covering need-to-know information about postpartum anxiety as we optimize your life. What You Need to Know About Postpartum Anxiety by Jessica Jondle with Healthline.com. It's natural to worry after the birth of your little one. You wonder, are they eating well, sleeping enough, hitting all their precious milestones? And what about germs? Will I ever sleep again? How did so much laundry pile up? Perfectly normal, not to mention a sign of your already deep love for your newest addition. But sometimes it's something more. If your anxiety seems out of control, has you on edge most of the time, or keeps you up at night, you may have more than the new parent jitters. You've probably heard of Postpartum Depression Ppd. It's gotten a lot of press, and trust us, that's a good thing, because postpartum depression is very real and worthy of the attention. But are you aware of its lesser-known cousin, postpartum anxiety disorder? Let's take a closer look. Symptoms of postpartum anxiety. Keep in mind that most, if not all, new parents experience some worry. But the symptoms of postpartum anxiety disorder include constant or near constant worry that can't be eased, feelings of dread about things you fear will happen, sleep disruption. Yes, this is a hard one to pick out since newborn means your sleep will be disrupted even without having anxiety. But think of this as waking up or having trouble sleeping at times when your baby is sleeping peacefully. Racing thoughts. And as if all that wasn't enough, you can also have physical symptoms related to postpartum anxiety, like fatigue, heart palpitations, hyperventilation, sweating, nausea or vomiting, shakiness or trembling. And there are a couple of even more specific types of postpartum anxiety: postpartum panic disorder and postpartum obsessive-compulsive disorder, OCD. Their symptoms match those of their non-postpartum counterparts, though may relate more specifically to your role as a new parent. With postpartum OCD, you may have obsessive, recurring thoughts about harm or even death befalling your baby. With postpartum panic disorder, you can have sudden panic attacks related to similar thoughts. Postpartum panic attack symptoms include shortness of breath or a sensation that you're choking or unable to breathe, intense fear of death for you or your baby, chest pain, dizziness, and a racing heart. Versus postpartum depression. In one study, Trusted Source looked at 4,451 women who had recently given birth. 18% self-reported symptoms related to anxiety. That's huge, and a significant reminder that you are not alone in this. Of those, 35% also had symptoms of postpartum depression. This shows that you can certainly have PPD and postpartum anxiety at the same time, but you may also have one without the other. So, how do you tell them apart? The two can have similar physical symptoms, but with PPD, you typically feel overwhelming sadness and may have thoughts about harming yourself or your baby. If you have some or all of the symptoms listed, but without intense depression, you may have postpartum anxiety disorder. Causes of postpartum anxiety. Let's be honest, a new baby, especially your first, can easily trigger worry. And when every new product you buy carries with it an all caps warning label about sudden infant death syndrome, SIDS, it doesn't help matters. But how can this worry really turn into something more? Why does this happen? For one thing, during the whole trying to conceive, pregnancy, and postpartum process, your body's hormones are going from 0 to 60 and back again. But why some women get postpartum anxiety disorder and others don't is a bit of a mystery, given that the hormone fluctuations are universal. If you had anxiety before your pregnancy, or if you have family members with it, you're certainly more at risk. The same goes for obsessive-compulsive disorder. Other factors that can up your risk include history of eating disorder, previous pregnancy loss or death of an infant, history of more intense mood-related symptoms with your period, and one study found that women with previous miscarriages or stillbirths were more likely to have postpartum anxiety. Treatment for postpartum anxiety. The most important step in getting help for postpartum anxiety is to get diagnosed. That 18% figure we mentioned earlier for postpartum anxiety prevalence, it could be even higher because some women may stay silent about their symptoms. Be sure to go to your postpartum checkup with your doctor. This is usually scheduled within the first 6 weeks after delivery. Know that you can and should also schedule a follow-up appointment whenever you have worrisome symptoms. Both postpartum anxiety and PPD can affect your bond with your baby, but there is treatment available. After talking about your symptoms with your doc, you may get medications, a referral to a mental health specialist, or recommendations for supplements or complementary treatments like acupuncture. Specific therapies that might help include cognitive behavioral therapy to help reduce focus on worst-case scenarios, and acceptance and commitment therapy, ACT. Certain activities can also help you feel more in control, like exercise, mindfulness, and relaxation techniques. Not buying it? One study of 30 women of childbearing age found that exercise, especially resistance training, lowered symptoms of generalized anxiety disorder. Now, these women were not in the postpartum stage, but this result bears considering. Outlook for postpartum anxiety. With the right treatment, you can recover from postpartum anxiety and bond with your sweet little one. You may be tempted to put off treatment due to thinking, my anxiety will go away when Junior hits the next milestone. But the truth is, anxiety can snowball quickly rather than resolve on its own. Remember, ladies, the baby blues are common, but they usually only last a couple of weeks. If you're dealing with longer-term, severe worry and symptoms that are getting in the way of life with baby, tell your doctor, and don't be afraid to keep bringing it up if it doesn't get better with initial treatment. You just listened to the post titled, What You Need to Know About Postpartum Anxiety by Jessica Jondle with Healthline.com. ORD listeners, if you're here, then you're as excited as I am that mental health is becoming not only more talked about, but that there are so many more resources for those in need. And one of the best resources available is our sponsor, Noom Mood. Noom Mood guides you to mental wellness one step at a time, giving you the tools you need to tackle stress so you'll feel empowered to take on whatever life throws at you. As for me, I really get caught up in cyclical, obsessive thinking, going way past productive thinking and deep into rumination. But Noom Mood has helped me to not judge my thoughts, while also helping shift them into thoughts that are more healthy and driven. And Noom can help you the same way, because you're bigger than your troubles, you're capable of adapting more than you think, and Noom's behavior change experts know that. So start to worry less and feel happier by using Noom for just 10 minutes per day. Sign up for your trial at Noom.com/ORD. That's NOOM.com/ORD to start your trial today. And thanks so much to Jessica for that great read, the education, and the tips that came with it. I'm going to keep this intro nice and short for the Friday show. Have a great rest of your day, everybody. Enjoy yourself, and know that I'll be back again tomorrow for our Q&A episode. Really hope to see you in that one, where your optimal life awaits.